We have Dr. Adhika with us, sharing her experience into getting into this program, and she has done quite a lot, and we are really excited to hear from her.
Okay, thank you. All right, so I'm Dr. Radhika Ruparel, and I'm currently enrolled at the IDS program at University of Pacific Arthur Dugoni School of Dentistry, and I'm a D3, so I'll be graduating next year. Next slide, please. You wanna switch? Thank you. So I'll start with my background, and then I'll go over my CAPIT profile a little bit, and then a day in the life of a IDS student at UOP, and then a few leadership roles at UOP because UOP is big time on leadership. So starting with my background, I graduated from Karnataka School of Dentistry in Gujarat in 2018, and then I moved to USA immediately after that, and I started my MHA in January 2019, and I graduated from my MHA in 2020, and then I worked as a dental assistant and a treatment coordinator for a while before I got into UOP. And I started at UOP in 2023 July, and I'll be graduating in 2025 June. Next slide, please. Okay, so this is just a brief about my CAPIT profile. I've not put everything, but you guys can ask me anything after we are done with this. So my GPA was 3.9, BDS, MHA both. I had 1 year of work experience in my country. That was during my internship. I was working as a junior doctor at one of my faculty's private practice. And then I did MHA at Rutgers, and I worked as a general dental assistant for about 3 months, after which I moved to ortho assistant as well as a treatment coordinator at the same practice for about 2 years. Um, and to add to it, I took a pharmacy technician license because I wanted to volunteer during the COVID-19 pandemic as an immunization tech. So for that, I had to take a pharmacy tech license. I had to take immunization license. So these two were the licenses that were required to actually immunize the COVID-19 vaccines. Apart from that, for professional licenses, I took New Jersey State X-ray license, the dental assistant license, and the one that I talked about, pharmacy tech and immunization license. And then I had multiple volunteering experiences at a couple of dental practices here, as well as nonprofit organizations, which I can talk about later. And then I had three LORs for my profile. One was from my Indian dental school dean, dental school professor, and then one from the ortho uh, doctor that I worked with in New Jersey. Next slide, please. Okay, so this is what you want to expect if you get into the school. The program length is 2 years, which is, I think, one of the shortest programs in terms of IDS programs. The number of seats are now 57. Earlier, we had about 27 seats, but last year they increased it to 57. So 27 seats will be in San Francisco campus, and the Sacramento campus will have 30 seats. In total, 57 seats. So the interviews are normally held in October, mid-October to the end of October. The interviews are usually in person now, but no bench test. They've stopped bench test at all. And then you also get an option to interview online. And then by the end of November, probably after Thanksgiving, you get a acceptance notification. The school starts first or second week of July, and the school has a quarter system. So you'll go through 8 quarters, and each quarter will be about 2.5 months. Next slide, please. So a typical day at the school, I've put this in very short. So UOP is very famous for the fact that we get into clinics very soon as we enter into the program. So I think only the first quarter you are in the sim lab, second quarter onwards you get to see patients. So that's a plus point at UOP. And first and second quarter, first quarter is entirely sim lab, second quarter is partially sim lab, partially clinics and lectures, of course. Quarter 2 through 6 will be lectures, clinics, and then 7, 8 will be completely lectures, 8 to 9, and then completely ADEX prep and clinics. And you'll be trying to finish your quotas. And then for UOP, the ADEX exam is usually in April or May. You have to pick a date, either in April or May. And the graduation is in June. Next slide, please. So UOP is very big on leadership and volunteering positions. So if you interview at UOP, you definitely have to talk about leadership. So this is just a brief about what the positions that are available at UOP. So normally there are a couple of class leaders. We have ASDA rep, we have ADIA rep, we have CDA rep. So if you happen to get any of these positions, you get to attend all the conferences, you get to take care of the class schedule. You get a lot of power if you happen to be in one of these positions. There are so many volunteer programs. One of them is Scope. There are mission trips to Jamaica, Guatemala, Philippines, where you get a lot of exposure. So recently I went to Jamaica for a field trip, and I think in a span of 1 week, I got to do more than 50 surgical extractions and a lot more apart from that. So we get a lot of exposure in UOP. Then again, a lot of volunteering opportunities. And then a good thing is we do have a Stanford University collaboration at UOP. So once you're done with your first year as IDS student, you get a chance to apply at Stanford University for a surgical rotation. And I think maybe 5 out of 27 people do get picked to go and work at Stanford for 2 to 3 weeks. And there also you get to do everything surgical. So that's a plus point for your CV if you want to apply for masters as well. Next slide, please. So this is just a normal day at UOP. The left side is the picture of sim lab. We have a lot of fun in the sim lab. And on the right side, you see that is how our clinics look like. So you have two computers. Everything is controlled via iPhone. So it's very advanced in terms of technologies. Next slide, please. And then on the left side is the SimLab station. Everyone gets their own computer. Everyone has their own mannequin, and pretty much it's a simulation of our clinics. And on the right side is a it's pediatric scope program, so you get a lot of volunteering opportunities too. I think that's all, and then now you can ask questions.
Thank you so much, Dr. Adhika. It was a beautiful presentation. If anybody has any questions here, feel free to unmute yourself and ask, or you could also put down your questions in the comment box. Well, I do want to start by saying I'm curious to know about how your experience was in Stanford because I did see that you had the opportunity to, collaborate and be there. So how was your experience altogether?
I think it was great. It was once in a lifetime experience. You get a Stanford ID card, you get to work there. So, and I think Stanford is big time on surgical cases. They just do surgical dentistry. They don't do regular bread and butter dentistry. So, all the cases are done in operating room under general anesthesia. So, you get to do full mouth extractions, full mouth implants. You get to do bone graftings, Botox, lip fillers. And I think they let you, major surgeries you can assist, but full mouth extractions, implants, they let you do it. So I think it's a really nice experience and it's really good for your CV if you plan to apply for residency.
Yeah, just by what you said, it does feel like it's an amazing experience. So,
Yeah.
do you have it completely clinical, or do you also get to attend some lectures there?
At Stanford? No, it's
Yeah.
completely clinical.
Okay.
So we have a faculty with whom we have a collaboration. So that faculty comes to UOP as well as goes to Stanford. So we do have guest lectures from him on surgical dentistry once in a while, but it is at our school. It's at UOP.
Okay. Okay.
Yeah.
A next thing was about you did mention about how you had certain licenses with dental assistant and like
Mhm.
pharmac, as a technician and everything. So, what was the kind of like for in general, if people were to apply for a DA license, what's the best way to get it in the US?
Um, so I don't know the every detail of it because I've forgotten it's a long time back. But from what I can say is for New Jersey state, if you are an international dentist, and I think a lot more states too, if you are an international dentist, you just have to clear 3 exams of dental assisting in. So you can enroll for it in DANB, that is Dental Assisting National Board. And the exams will be infection control, radiology, and general assisting. So if you clear those 3 papers, you get the DA certification. And then if you want to get registered in the state, you can just send out an application and I think a cashier's check, and then you get registered in the state. And then for What was the second question that you
The
asked?
pharmacy technician license part.
Yeah, so that's a little tricky. So you need to find a pharmacy that can let you volunteer.
Okay.
So if they happen to let you volunteer, then what you can do is there's a pharmacy tech course at
Okay.
website called Health Mart University,
Mm-hmm.
and they will assign you that course. So you can pay for it, or they might pay for it. It depends on the pharmacy owner. And then you finish that course. I think the course is about maybe 2 day online course. It's like 8 or 12 hours. You can finish it quickly too, and then pass the exams, and that's all. You get the pharmacy technician license. Once you get the pharmacy technician license, you give a practical exam. So the
Okay.
pharmacy will help you enroll in it, and you inject a saline, intramuscular, and subcutaneous. Uh, it's just saline. So someone from the pharmacy will volunteer for that, and then you can just inject the dose, and then there will be a video call where the state authority will be looking at you, and then you get the license. I think that was the protocol during COVID, but now there might be exams in person too. So
Okay.
to double check, but I think that is how it works in all the states.
Okay. Could you tell us more about your application process? Like when did you start and,
Yeah,
how did you prepare for it?
I think we have one chat in the chat
Oh,
box.
yeah, there was a question about as a dentist, you get the license of a pharmacy technician.
Yes, so for pharmacy technician license, you just need to have basic diploma. So even if you're 12th pass, or I think 1 year, if you've done 1 year of college anywhere in US or outside US, you're qualified for that. So you don't need a
Okay.
dentist license. Yeah. Yeah.
Okay.
What's the other question that you asked?
Yeah, I wanted to know more about your application process. When did you apply and how did you go about that whole planning situation?
Okay, so I I think my cycle was 2022 cycle. So I took a couple of licenses because I wanted to stand out, because everyone has a DA license here, most of them who are applying. So I think that's pretty common. You need to find something that is a little different from what everyone is doing. So for me, that was pharmacy tech. But you can do anything. People have been doing a lot of things. If you're in Florida, you can take dental hygiene license.
Yeah.
So I wanted to do something different, and then volunteering. Yes, I volunteered at a lot of general dentist office, and then at the ortho office. So I was working at the ortho office through my OPT from my master's. And then apart from treatment coordinating that I was doing there, I got to do a lot of ortho work. And the dentist happened to be an Indian dentist. So they usually allow you to do a lot more. And in terms of ortho assisting, it's very hands-on. So you get a lot of exposure in ortho. So I had put a lot about ortho in my profile. So that helped. And I think this license and volunteering experiences, I think that was something which was different, and I think everything else was pretty much similar to other candidates. And in terms of UOP, I can say that they take varied number of candidates. So some people in our class are endodontists, some are prosthodontists, and some are fresh grads. So they don't have any particular thing in their mind. They just want some mix of a class where people can collaborate. Some people are young, some people are old, so that is how they collaborate. That is what is their ideology, I think. And I got to talk to the admissions department too recently. We had interviews for 2027 batch. So
Yeah.
they said that we are not looking for a dentist, we are looking for someone who we can teach, a person who is teachable. That is all we are seeking, and someone who can take good leadership roles. So I think that is their whole ideology from what I can say.
Okay. And
Yeah.
coming to the part where you said you have two campuses in SF and in Sacramento. So which campus are you in, and is there any difference between the two campuses as well?
Yes. So when I was in the admission process, we just had one campus. We just had 27 seats in 2022-23 cycle. Um, and that is in San Francisco campus. That campus has been there since years. The IDS program has been going on over 50 years now there. I think it was one of the first five IDS programs in US. So that program is quite old, but recently they opened a new healthcare center in Sacramento exclusively for IDS students. And they have 30 seats. And the coming batch will be their second batch.
Okay.
So it's pretty new. They're trying to develop more things. They don't have DDS cohort. They don't have residencies. So I think both of them have advantages. San Francisco campus has an advantage because we have a lot of specialists here. You can do second molar endos, you can place implants, you can do surgical extractions, you can do disimpactions, because we have a lot of specialists here, but also we have to share the patient pool. We're
Yeah.
sharing with the TDS cohorts too.
Yeah.
For Sacramento, the advantage is it's only exclusive 30 people from IDS. So I think they don't share the patients, but they don't have seniors and they don't have specialty doctors, or they don't have specialists for performing complex procedures. So they are also new. They're in the process of development. So I don't know how is it going to work, but I think
Okay.
that is how it is for now.
Okay. That's good to know. I mean, since it's just coming up and everything, it's good to have
Yeah, yeah.
that up there. Thank you so much for answering that question.
Welcome.
I do want to say that if I've seen a couple of them who have joined us now, please feel free to put down your questions in the comment box and we can answer them. Coming to the next one, I wanted to say of how was your interview process like? Was it virtual? Was it in person? And
Yeah,
since you've already been a part of the recent interview batch,
yeah.
what do you have to say from that experience for the upcoming applicants?
Okay, so for me, I was the post-COVID batch, so I had virtual interviews. Everything was pretty straightforward. They're really organized. I would say they're the most organized school out of all the schools that I've interviewed with or I've applied to. They'll tell you everything a month or a month and a half in advance, so you can plan and prepare accordingly. So normally it's a 1 week interview process if it's online. The first day will be orientation, and second day will be the interview starts from second day. So you get picked in any of the slots. The interview is typically in a span of like 4 days. You can be selected for any of the interview batches from Monday through Thursday. Orientation will be typically on Sunday, and then during orientation you expect IDS panel. The students will get to interact with you, and you can answer their questions one on one in the student panel. Apart from student panel, they'll discuss the financial aids with you. They will talk to you about loans and everything that needs to be taken care of if you get accepted. And I think interview, and the interview is one on one. Apart from that, I would say yes, so there's critical thinking assessment, but they change it every year. I had a critical thinking assessment, though there are multiple choice questions, and you get typically 20 minutes for that for 10 questions, or 10 minutes. I don't remember. They change it every year. So, it's different every year. And there's writing assessment. They ask three questions. This has been the pattern since past 3 years. They have been asking three questions about the writing assessment. So I think that usually happens on first or second day of the interview. But if you choose to go in person for the interview, the first day is orientation as usual, and just 1 day of interview, and the critical thinking and writing assessment is done on the first day itself.
Okay.
Yeah, that is how it works. And the interview is pretty straightforward, 20-30 minutes interview. It's just conversational, no dentistry questions.
Okay. So it's
Yeah.
pretty much kind of intense, but it's also well organized and everything. Do you also happen to have bench preps along with it or no?
Bench
I
preps.
mean bench exams.
No, UOP is completely stopped bench exams and they are not planning to start it.
Okay. We
Yeah.
do have a couple of questions in the chat box as well. First
Mhm.
one we have if you can have a low GPA like 3.5, is it acceptable in UOP?
Yes. So your GPA starts all the way from 3 up to 4. It's a mix of class. Even with TOEFL score, I think TOEFL average for the class will be 104, but I think 95 score has been accepted too last year.
Okay. Next question we have is we do get a comment on saying how beautiful your presentation was, and what are the areas of focus for the SOP while applying to UOP?
I would say leadership and your past leadership experiences, that would help a lot. And don't talk much about dentistry because they really don't care about it. leadership, and I would say volunteering experiences. And the way you present yourself, that's very important. Even with the interviews, so I don't know if you know about it or no, but UOP was the only school where we had to wear formals even in the clinic. So we had to
Okay.
wear blazers and everything in the clinic. But last year we filed a petition to change it to scrubs. So now so my first year was in formals, but now we have switched to scrubs. So I think they look at you when you come for the interview, you should be very presentable, completely well suited. They're big time on presentation and leadership. So I think that should be very important.
Okay. Next question we have is, what is the writing assessment we're just talking about?
So writing assessment questions are pretty basic, generalized questions. So from this year, I can say this year and from my year, the questions were what are the qualities of good dentist? What are the three leadership qualities that you must possess if you want to be a good clinician? And I think it was one time in your life when you had to face something unpleasant and how did you deal with it? Something like that. So all the questions will be like that always.
Okay.
Yeah.
Okay. One more question was that when you're applying for your applications, I think, do we have a specific CV template for the UOP to be followed, or what do you?
Yes.
Okay.
UOP has their own template and you have to follow that template. If you don't follow that template, you are automatically disqualified from the pool of applicants. So be
Okay.
very careful when you're applying. Follow their template. They're
Okay.
very particular about that.
Okay. Another question is about TOEFL. So, like, what's the range of TOEFL acceptance of the score that should be there?
So if you open the website, they usually they have all the statistics from the previous class. So currently they will have the statistics on their website for my class if they have not updated it. But they'll say that the average TOEFL score is 103 or 102. The lowest is this, the highest is this. Same with the GPA. The average GPA is I think 3.4 or 3.2. I don't know what is the current GPA on their website. But they have all the statistics on their website. So I think that's the best place to look at the current trends. But I think all the way from 95 to over 110, they accept it.
Okay.
Yeah, but
And
it's always better to stay over 100 because a lot
yeah.
of people are above 100.
Okay.
Mm.
Next question was about how was like in based on your class
Mhm.
pool and everything, is it more about students being accepted as fresh graduates as well, or do you have to have a master's or a preceptorship? So what do you have to say based on that?
So I think for UOP, um, it's a mix of everything. But in my class, I can say that only two people have done masters, and a lot of people are fresh grads. So I think half of our class is fresh grad. So recent graduate, or some people came straight from their countries without any masters or anything, just fresh grads. Some people have their masters in US. But I think on an average for my class, the age acceptance age was 27, 28. So that's pretty good as compared to other schools that prefer masters. And for the next batch, like my junior batch, a lot of people have done their masters. So
Okay.
UOP has a trend. Some batches are very young, some batches are pretty old. So I don't think there's any specific criteria. It's a mix of everything. So it doesn't really matter.
Okay. And we have another question about any preferences the school has for visa holders versus green card holders for the program.
No, I think in a batch of 27, more than 20 people are on visas in our class. So they don't care. They will sponsor the visas too.
Okay. I think one more thing was about the ADEX licensure exam. So can you tell us a bit about that and how's the requirements for it and what it does?
So for us, the every school has a different set of dates for ADEX depending on their graduation. So for us, the dates will be in April and May. We're currently starting to prep for it. We haven't really started aggressively, but I think most prep will start after January. But from what I can say is ADEX is usually 3 to 4 day, and there's restorative exams, class 2, class 3, class 4. We have perio exams, SRPs. Then we have endo exams. Endos are pretty tough. You have to be on point for endos, but everything will be on typhos. Typhos will be provide. ADEX has completely different typhos, and the school does provide with a typho which is very similar to the ADEX typhos. And I think they help us in prepping for the exams for about 3 to 4 months. I think 3 to 4 months should be enough because UOP is very particular about their SimLab criteria too. So we are already in a habit of making ideal preps. So I think that should be pretty easy. Prepping for ADEX license should be pretty easy. Yeah.
Okay. And does that licensure help? Is it for just that state or is it in general to all the states?
So ADEX is general to all the states in US except for New York. So
Okay.
for New York, you need to do either a GPR, AGD, or you need 2 years of experience in other state in order to be eligible to practice in New York.
Okay.
Otherwise, all states ADEX is eligible.
Okay. Well, we've kind of answered a lot of questions. Do we have any more? Okay, we have one more asking, did you take any bench prep class while you were applying?
I did. I did Stevenson, but honestly, it didn't help me because I was a COVID batch. None of my interviews really had bench except for Minnesota. But I ended up not going to Minnesota because I had other acceptance. So I didn't go to Minnesota bench. So it didn't help me, but you can definitely take bench test, sorry, bench prep classes.
Okay. What according to you is like a strong application while applying? Not just for UOP, but like, yeah.
In general, I think you should have a mix of everything, a lot of volunteering experiences. It doesn't matter if you're in the other country or you're in the US, but some sort of clinical experience might help, and something different to your profile might help. Say, for example, hygienist license or you so honestly, our class has a very varied kind of experiences. Some people used to work at a restaurant and they have said that I was very hardworking. I worked at a restaurant in order to be able to make funds to apply to dental school. So everything that you've done is okay. It doesn't have to be clinical, but you should be able to express everything on your SOP. I think SOP is very important, no matter what you have done. But if you express it in a way that they can see your struggle, or they can see that how desperate are you to get into dental school, that might help. I think for me, I had put everything into the SOP in that 50 to 100 characters, whatever I could, I put. So I think SOP is very important.
Okay. And one more question was, should we take the bench prep course before applying to CAPIT or just before the bench test?
I think after applying, probably around May, June should be the best time because most schools they call you for bench after April. Maybe April is also a good time. I think Alabama is in April, May, then Indiana. So I think first you apply and then go for your bench and then keep on practicing it. Don't leave that practice. I made a mistake. I didn't practice it after coming back from my bench prep. So I lost a hang of it. But if you keep on practicing, get everything that needs to be done, or get everything at your place and keep on practicing at your own house, or maybe find a dentist where you can practice. I think practicing will help, and I think after applying should be
Okay.
a good time.
Okay. And about the bench test, is there any preferences for like using Typhodons, Kilgore, Columbia, or Accidental? Do you have anything to say on that?
Doesn't really matter because every school uses a different typhodon, but I think Kilgore is very most common
Okay.
is used here. So I think, but again, it depends on what school you are interviewing for. But practicing, I practiced on Kilgore, so I think Kilgore was pretty decent for practicing.
Okay. All right. Do we have any more questions? Okay, I think we have kind of come to the end of, okay. If anyone's typing, I can wait. All right. You're welcome. And all right, I think we did have a lot of questions answered today. And thank you so much, Dr. Radhika, for really explaining head on about everything in the whole process. I hope that you enjoyed the session as well with us and those who have joined as well. Thank you for spending your weekend, and I hope that this has been very useful for the upcoming applicants. And all the very best, Dr. Radhika, for your upcoming ADEX exam
Thank
as
you.
all right. Thank you so much, everybody, and have a good weekend.
See you guys.
All right. Bye bye.